Hi, hello, hello, hello. It is Medical Monday time. Come on in, like, invite, and share as you guys come on. Please like, invite, and share as you guys come on. We're going to have a wonderful time on tonight. I'm Dr. Grace Patterson, Managing Owner of Bethesda Holistic Center and Everything New Alternative Medicine Services. We also do visiting physician care services for the elderly, sick, and disabled, and shut in. So I would like for you, as you come on, please like this video, share this video, and invite people to come on. We're going to be talking about vitamin infusions tonight. Our practice have been doing IV vitamin infusions is what we call now is trending, and but I have been doing vitamin infusions now. Let me see. Oh my goodness, it is 2019. I want to say that I have been doing them since, let me see here. It's been a while now. I want to say maybe, hmm, I should know this. I'm trying to go back in my head. Do, 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 do. I want to say that we have been doing them for, it's 2019. So I want to say maybe around 2013, 14. So we have been doing them for quite some time now. Now there are people that are doing them now. Some good friends of mine who are some nurses out there, and they I want to congratulate them on their new venture. But we have over 20. I counted them today. We have over 25 formulations that we can provide for our patients, along with the customization that we talk about with our health mapping. So what we do, we actually, I'm getting a little ahead of myself, but it's 8:02. But I want to give you guys, hey Dion, I want you guys to get in to like, invite, and share, invite your friends on, so we can get to talking about this vitamin infusions. Like I said, it's trending now. It's becoming very more knowledgeable, and people are more aware due to social media and internet and things like that. But it has been around for quite some time. So before I get into talking about it and the history of it, I want you guys to invite people from your social media family to come on and join us tonight. So please like, invite, and share those on tonight. Please have them to come on in. Um, like, invite, and share. I'm Dr. Grace Patterson, Managing Owner of Bethesda Holistic Center and Everything New Alternative Medicine Care Services that we provide from the inner city to our high-end clients. And we do have some high-end clients that's in the inner city. So I just want to say thank you so much for the support that I've received down through the years from those who have been consistent in getting their services. I really do appreciate you, and I want to give a shout out to you. Thank you so much for all that you have been doing. Please like, invite, and share as you guys come on. Who else came on? I saw Dion. I saw Carmen Evans, Timothy Hinton. Hey Tim, thank you for joining on. Please like, invite, and share as you guys come on. We're going to be talking about vitamin infusions tonight. And again, like I said, I've been doing this for quite some time now. I want to say, might even be consistently, I want to say about 2013, 2014. But I really found out about vitamin infusions back in 04, 05. But at that time, I was on a sabbatical. I was not practicing medicine. I was actually working inside of a clinic that was providing those services, and I was working as a phlebotomist. And so that's how I found out about Myers cocktails. Um, so I want you, known as Myers cocktails, but it has grown since then tremendously by leaps and bounds. So I want you guys to come on in, like, invite, and share as you guys come on. I don't know why I'm trying to log into my email because I emailed myself some stuff. So I'm trying to let's see, Dr. Grace. I don't understand what's going on here. But anyway, I'm trying to log in here. So please like, invite, and share as you guys come on. We're going to have a great time tonight. I'm going to be talking about some things and talking about some services that we provide. Next week, what we're going to be doing, there we go. Next week, what we're going to be doing is we're going to be talking about hair restoration. I talked about that before, especially those of you out there talking about getting those edges back. Yes, we're going to be talking about that for sure. So please like, invite, and share as you guys come on. Um, Let me see. Here we go. That's not the one I want. Okay. That was another link. Guys, hold on just one second. I need to send myself something and I need to get it from my notes. So hold on just one second while I get my notes. Let's see. I have to get it from over here possibly. Please like, invite, and share as you guys come on. Like, invite, and share. Like, invite, and share. Okay, I guess I'm gonna have to go back to what I was doing. Hold on. Like, invite, and share. We're gonna be talking about vitamin infusions. So, this is part of our practice that I have been talking about for since I've been on Medical Monday. We do what we call health mapping, where we actually do individualized testing to see what a person's deficiencies are, and we actually come up with what we call customized formulations for the patient, and where we actually infuse it. Now, there's some things that cannot be infused, but there are some things that are. And in conjunction with that, we have over 25 different formulations that is available to you. Now, there is what I call designer IV, and then there's actually what I call restorative IV therapy. And we practice both. Designer mean is like it's the new thing in, and you don't want to take any oral supplements because there's a lot of people who just don't like taking pills. So what they want to do, they want to get an infusion. So we provide that service for them, but we really recommend that they actually get the testing so we can customize what they need. So, like with anything, and I said this before, and I've said it on shows before, just because it's natural, that doesn't mean that it's actually safe. Let me say that again. Just because it's natural, that doesn't mean that it's completely safe. Excuse me, because you have to learn and know how to use supplements and combinations because we have different combinations for different things. So I'm gonna just throw this one out there. We have a combination for people that have allergic rhinitis or sinusitis every year. So we give them that infusion before the spring, before the weather breaks. And so just as an example, and then we have things for immunity and things like that. But again, if you're someone under the sound of my voice, I highly recommend if you're going to do an infusion for the first time, you definitely need to know what you're deficient in. You may not be deficient in anything, but at least you will know. Because I have done people and they have not been deficient, but they have been borderline, which means they're close to being deficient. And so we get those numbers up so they won't become deficient. So let's talk about. I was trying to look this up. Let me see if I can find it. Da 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 da. It started. I found out about the IV infusions by the name of Myers cocktails, which was formulated by a doctor by the name of John Meyer. Okay, and that's where it basically all began. And so it's just a combination of vitamins that is given through IV to people who want to supplement themselves. So his name was John Clayton Meyer. He I got the wrong person. John Clayton Meyer is a singer. Okay, let me get this right. John Meyer. Let me just put my cocktail in what I get. And so I tried to have this ready. Okay, Myers cocktail is Myers. It's an IV, and it's intravenous nutrient mixture invented by a Baltimore physician, John Myers, containing magnesium, calcium, various B vitamins, and vitamin C that claim to be beneficial for a broad range of conditions. The treatment is common among naturopath doctors in the United States and Canada. But again, you have to be careful when you are doing infusions because, let's say, for instance, you're doing infusion with for someone. I'm gonna just throw this out there, especially you providers that are doing IV infusions. You have to be careful, especially when you use minerals like calcium. And let's talk about calcium for a moment because calcium, is good for maturing people, especially women, and men too, because as we mature and we need calcium for strong bones and teeth, right? But then there are some of people or patients that you may have that may have cardiac issues, and so you need to be careful with infusing calcium. So that's why it's very, very important on the front end. I'm quite sure you're doing this, but I just want to throw that out there that you take a history in regards to what medications that they are on. So, do you give calcium infusion to someone who's on a calcium channel blocker? Let me just throw that out there. So, that's the question that you need to have answered before you start doing these type of things. Most oftentimes, people see stuff that other people are doing and just say, "Hey, I'm going to do that," without having any training in it, any history in it, or whatever. But again, I have been around Meyer cocktails and infusions. I want to say, let me see, let me see when I was working as a phlebotomist. I would say about 2003. So it's 2019. So for me, it's been about 13 years. So for me doing it as a physician, I want to say consistently, I would say around about 2012, 2013, 2014. So it's been about years now since I've been doing this. So it's very, very important that you guys educate yourself on what to give, how to give it, and things of that nature. Now, most of what I've been seeing on the internet and what I've been seeing advertised. Hey, Maria, thank you for joining on. Hey, Linda Jackson. Jacqueline Nellums, Miss Mazine. Hey, everybody. Thank you for joining on. Please like, invite, and share as you guys come on. Hey, Carmen Evans. Thank you. Everybody like, invite, share as you come on. What I tell people to do, I've been seeing these IV bags, which is great. And you can get an IV infusion anywhere from 30, 45 minutes. But we at Bethesda know how to give those infusions in less than 30 minutes. So if you're a provider under the sound of my voice and you're interested in learning how to do the IV infusions and get certified in it, we're going to be offering a course on how to do that. And I'm going to provide a link where you can register for the class, and and I will let you know when we're going to, as people register, we're going to post a date. It's to be determined, but you can register now. But the thing is, you got to know what you're doing. And so, a part of the class, we're going to be covering 5 areas in the class. Now, this is for people who are doing IV infusions or interested in doing IV infusions, because as doctors and as providers, being physician assistant nurse practitioners, we need to diversify our streams of income into our practice. With the new Medicare changes, insurance changes, we can bill a certain amount for our services, but that doesn't mean that we're going to get that amount. And I've talked about that before. So you have to become creative in multiplying streams of income into your practice, while at the same time providing good quality care to your patients. And then a lot of people don't have insurance, so this is cash for service. Now, when I talk about natural services, there are some insurances who are now trying to get on the bandwagon and trying to provide some type of alternative services through their insurance benefits. You need to research and find out who those insurance carriers are. But most oftentimes when you're doing homeopathic, natural, alternative medicines, is cash and carry, okay? It is what it is. But then there are some creative ways that you can do to provide services for your patients, providers, in regards to the administration of what you're doing without billing the insurance for the cash portion because it's not covered. So you have to be creative, but you also have to be integrous in your billing practices. So we part of the course will we will talk about that too. So we will be talking about designer IV versus restorative IVs, how to correctly combine supplements to help the body to combat disease and disease states, how to give IV supplements under 30 minutes. We'll be talking about that, and I'm not talking about an IV bag or wide open either. I'm not talking about that, but there is a way that you can give supplements or the IV infusions in less than 15 minutes, 10 minutes. How to do health mapping will be part of the course, and medications and supplements, where to give and not to give. So we are talking about possibly starting the class in I would say, in June. We haven't picked a date yet, but we know it's going to be in June. So I want you guys to, if you're a provider that is watching this and this is something that you're interested in being part of, you have to register. So I am going to post the link on in the comments section, and if you're a provider who wants to partake in this, it will be great that you register, and you will not only be taught on the appropriate ways on how to do IV infusions, but you will be exposed to the many different modalities and combinations of infusions that are out there for particular disease states. And we're going to show you how to do that, and we're going to show you what those combinations are, because most IV infusion place, they may have, like I did the counting today, I want to say they may have 7. But like I said, through the course of years and me doing this for a while and dealing with different companies, we have developed over 22. And then again, we have developed a way where you don't have to sit for 30 minutes, because you're going to have executives. You're going to have not only executives, but you're going to have stars. You're going to have celebrities who don't want to sit for 30 minutes. They want to get what they get, and they got to keep it moving. And so we have a way for them to be able to do that. And I want to share that with you and teach that because I really love to teach. That's why I'm on Medical Monday every Monday, because can't you tell I like to teach? So if this is something that you're interested in being a part of, I'm going to post it. You know how the computer does this, the little circle thing? I'm dealing with that right now. So give me a couple of seconds here so I can post the link for you. I am so excited about this. Really, 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 really excited about this. So I want you guys to know that, okay, here we go. That we are, no, that's not what I want. I want to highlight it. Okay, and then let me see here. I'm going to copy. So I want you guys to know that you want to be safe, you want to be knowledgeable, and you just don't want to be doing something that's trendy and that is a fad. Okay, don't get me wrong. We have done it on the designer side as well, because if you look at our website and look at some of my other videos, we have done what we call cocktail parties. And what it is actually parties where men, women, or whomever get together and they do the infusions. And to be honest with you, sitting there for 30 minutes at a party, but again, we have created a way where they don't have to sit there for 30 minutes. They have food and all that other kind of stuff. Is a networking event or whatever the case may be, or whatever. We have done parties on that extent for people that want to do that, and it's been fun. And if you want to host a party, you definitely can give us a call at 248-356-1111. That's 248-356-1111. We can definitely get that information to you on how to do that. And it's fun. It is so much fun. And what we also do during the parties, we offer the lab testing at the same time. So if you're someone that wants to know what your deficiencies are before you give the infusion, you do not give an infusion then draw blood, because your your results is going to definitely be skewed. So we talk about all of that, and the type of testing that we need. Lymphocytes are very important. So then we talk about that too. So there's a way that you do this, and it's not traditionally available, and so but it's going to be available now through Everything New Medical Care Services, through the education wing of our alternative medicine practice, that we're going to be providing courses and classes for providers that are watching and who watch. So I appreciate you guys tuning in every week and sharing this video. And so why is it important for you to get an infusion? Because what happens is, I hear people ask me this, what is the advantage? Because you got to remember that most supplements are not what we call FDA regulated, which is Food Drug Administration. It's not regulated. So they can advertise something being on the bottle, but that doesn't mean that's what's really in the capsule or in the tablet or whatever, the powder or whatever the case may be. So you have to swallow it, and so you have to, the saliva breaks it down, you have to swallow it, has to goes into the stomach, and the stomach has to break it down, then it goes through the GI tract, and then absorbed through the GI tract to the blood system throughout the body. So how much are you really getting? We don't know. So being IV infused, it goes directly into the bloodstream. So I've been doing this for a while now, and most of the times when people have deficiencies, they can actually, or having issues in their body, when we're actually infusing the supplements, people can actually feel. Hey, Sinitra, thank you for joining on. Hey, Cassandra, thank you for joining on. Please like, invite, and share as you come on. I have people who have said that they feel the vitamins in the areas that they have challenges in. So sometimes when women that have female organ problems, or people that feel like they're coming down with a cold, they can feel it in their throat, or they can actually taste the vitamins, or whatever the case may be. I've heard people who said that they were having issue with their eyes and nighttime vision. I've had people say when they went home, when they were driving home, it was like they were like in a video game, because everything was illuminated and everything was so crisp and crystal clear. So there's a lot of benefits to versus infusion actually um, being supplemented, or through an oral route. So what we do, we try to, or I shouldn't say we try, we do actually do the testing. And again, the testing, what it does, it tells you what you're deficient in, to the milligram dose if you want to do oral supplementation. Because remember, every supplement is not infusible. It can't go directly in the vein. So you have to do some oral supplementation or versus the IV infusion. And we infuse that to the milligram dose. And then a lot of people ask, I get a lot of questions, well, how often should I do it, and all that other kind of stuff. Everyone is different. So I try not to give blanket answers, because again, we individualize our services a majority of the time. The designer side is very little. We do it, and we have fun doing it. I mean, even if people that has offered us to go out of town and travel, we love doing that. But what we really want to do is to get the body in a what I call in harmony, where your body can auto correct itself by having the nutrients and the supplements that are needed at the time of the infusion. So I think that is very, very important that you guys understand what we provide, and partake in that. So it is very, very important that you. Why isn't this not showing? Okie dokie. So that you guys understand what we're doing. I have so much fun doing this. So I want you guys. There we go. This is what I'm looking for. This is what I'm looking for. Yay. So I want you guys to call us. If this is something that you're interested in doing, or something that you're interested in learning more about, please call us at, post a link if you're someone that's interested in registering for the class. Okay, I don't know why my computer is doing this. It's doing like this little shake, shake, shake thing, which I have never seen before. Okay, here we go. That was strange. So, this is the link for the course. So if you're a provider under the sound of my voice, be a doctor, physician assistant, nurse practitioner, a nurse, so if you're interested in learning more about how we do the infusions in less than 30 minutes, if you want to know about more, like I said, we have over 22 combinations that we can provide. How do you do the customization portion um, based upon the findings from the testing? Um, please, click on the link and pay for the course. I'll tell you, for those who register, we'll tell you what week in June. I haven't talked to my business manager. Okay, so that's why I'm like June sometime. So once I talk to my business manager, we'll definitely target a date. And we have our curriculum. I have our curriculum outlined, and I'm so excited about it because the more people that know about it, the more people we can help. I am not one of those people that hoard information and it's like mine, 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 mine. I don't want to share. I don't want to share. No, it's enough people out there for all of us to help and to make a good living at it. So if I can share the wealth and the information and the knowledge, I am going to do that because I do believe in helping people because that's what I love to do. So again, that is the reason why. Let's get back to the infusions. People say, what is the benefit of infusion versus oral supplementation? Because it goes directly into the bloodstream, and the body actually absorbs what is needed, and whatever is left over, basically you urinate it out. One of the things that I do, I actually add to my infusions vitamin B12. Um, because the liver can store some of it. Vitamin B12 is one of the few water soluble vitamins that the body actually can do some storing. The rest of them are water soluble. The fat solubles are A, D, E, and K, and they need to be taken with a good oil in order for them to be absorbed. Being that they are fat soluble vitamins, they can be stored in the body and can be toxic and cause problems. So this is one of those things where I said just because it's natural, that doesn't mean that it's not harmful, and that it can be harmful to the body, so not safe. So you have to know what is safe and what's not safe, and that's what part of the course and the classes that I'm going to be talking about. I say this when I talk about supplements. Another one, as a good example, is vitamin A. Vitamin A is teratogenic, which means that it can affect a developing fetus or a developing baby. So if you notice, most prenatal vitamins do not have vitamin A in it for that reason. So if you're someone who received that use retin A for skin, to keep your skin smooth and beautiful and youthful, and you're in childbearing age, you need to be careful because it is absorbed through the skin. And if you get pregnant while you're on retinol, you need to tell your physician right away because it can affect the developing fetus. Now, vitamin A is a supplement and it is natural, but it can be harmful, and it can be toxic because it is stored in the body too as well. Vitamin D, again, is toxic. It can become toxic if not taken properly and monitored, because now you have to monitor those vitamin D, because I supplement majority all my patients are on vitamin D. So I have to monitor their levels. Being that we're in Michigan where we don't get that much UV sunlight, which UV rays help make vitamin D in the body, and vitamin D is very important in creating hormones and other chemicals in the chemical supplements in the body. And being that especially the African American community, they have melanin in their skin, which also blocks UV rays. Vitamin D can be very low, and if you're low in vitamin D, it can cause a whole myriad of problems. So vitamin D deficiency can cause a problem, and vitamin D toxicity can cause a problem. So just because, again, it's a supplement and it's natural, that doesn't mean that it cannot be harmful. And those are most oftentimes are supplements that are not infused. Okay, those are fat soluble vitamins that are not infused. Okay, they're not injected either. So you have to be careful with that, and you have to know that. Okay. Another thing that I want to recommend that you guys do, all of you that under the sound of my voice, a lot of people say, well, for me, and I'm going to teach this in the course too to you providers out there, a multivitamin. Okay, vitamins should be taken in a certain combination in order to address an issue or a deficiency. So even in a deficiency, when you're giving something, you have to give it in combination so they can be absorbed and so they can work synergistically to correct the deficiency. And that's what we talk about during the courses that we provide. If you're a lay person and you want to be interested in taking the course, you can do it too, but I can't certify you to actually administer the infusions. But if this is something that you're interested in and want to be part of the class, we can offer that as well too to you too, because you have to take supplements in a certain combination. And at Bethesda Holistic Center, we pride ourselves on finding out. That's what health mapping is about. That's what we're going to teach in the course too. How do you health map? And that's a phrase that we coined at Bethesda Holistic Center, health mapping. Where you are right now, where do you need to be, and how we're going to get you there. And we have a formulation and a step-by-step how to do that. And if your provider is under the sound of my voice, we're going to actually do real case studies from our practice where you can learn from, and even new patients that you can learn from, so you could carry it over into your practice if you plan on doing what we call restorative IV infusions versus the designer IV infusions. So again, what is designer IV infusions? Oh, I just want to get this IV supplement because it's new and it's the new thing to do, and I want to hang out with my friends and go to this IV place and get my IV. Versus restorative, where you come to someone like myself, Bethesda Holistic Center, and maybe a few of my colleagues that I know that are doing infusions too, that are serious about not just doing the designer end, but also helping people and finding out whether they're deficient in. Because if you don't find out the issue and and you just taking stuff and you're feeling better, to me, in my medical professional opinion, you're using a supplement just like a pharmaceutical drug. Because pharmaceutical drugs, with their premise is not to cure, it is to treat a symptom. Okay, so you can do the same thing with a supplement. You can take a supplement, get infusions, take pills, take tablets, take vitamins, take powders, and you can feel good after you do it. But after you stop and those symptoms come back, that means you have not found out the source of the problem. So you're using a supplement just like you would a pharmaceutical drug. You're just using it to treat a symptom. And at Bethesda Holistic Center, we do not recommend that you just take supplements just to treat a symptom. We want you to do the investigative part, and so you can restore and put your body in what we call in a state of harmony to auto-correct itself. So on the provider side, if that's something that you're interested in learning about, click on the link, register for the class. If you're someone that is interested in finding out how to do the investigative work, not only do we do the micronutrient testing, which is a fancy word for vitamins, we also do neurotransmitter testing, which is the chemicals that are released from your nervous system, and along with your hormonal testing. And when I say hormones, most people automatically go to the thought of women. Men, your hormones need to be checked too as well, due to the fact of the matter that the times that we live in now. If you're a meat eater and you don't eat organic, you don't eat clean, there are hormones and steroids and antibiotics in meats, which affects the hormone levels in men. I have never, in my years of being a doctor, over 20 plus years, have seen young men, even elderly men, from young to older, that are having erectile dysfunction problems. And it has to do with the food and the environment that we live in, as far as how they process things now. And even pharmaceuticals cause problems with erectile dysfunction. There's a lot of medications they call gynecomastia in men, which means men breasts. So if you're someone under the sound of my voice that is what I call sexually pleasingly plump or overweight, and there are breast and you need a bra, I'm just going to be uh, serious about it. Uh, Trying to be a little comical here at the same time. You have to get your hormones checked out, and check your medications if you're on medications, to see if one of the side effects is boobs. And so, and in order for a man to develop the tissue in the breast area, there has to be a hormonal imbalance. So when I say hormones, please just don't automatically go to women having their menstrual cycle or women having menopause. Men can have what they call androgenal pause. They andropause, same thing. And so it is very, very important that you know where you are and what you're dealing with. And we teach you how to do that as a provider at Everything New Medical Services. But we also teach our patients that, because the best patient is an educated patient. So the stuff that I say here on Medical Monday, I try to keep it on as in what we call layman terms. Sometimes I do use a lot of medical jargon and medical lingo, but I try to keep it where if anybody looks at this video, they can understand what I'm saying and glean from it, and hopefully take something from it that you can do to help yourself. And hopefully one of those things that you glean from it is to say, hey, I'm going to give that lady a call, or I'm going to give that practice a call at 248 356 1111. That's 248 356 1111. So hopefully you will do that, um, because we want to help you and to see you get into a better state. Now, so what we do at Bethesda Holistic Center, again, we have over 22 combinations of infusions. And so I'm just going to uh, highlight two that we do under 30 minutes. The ones that's the IV bags that take more than 30 minutes. If you want to know about those, you have to give us a call, get a consultation. The consultation is free for the IV infusions. Just want to say that, to get you started. But if you want to do the investigative part, okay, the investigative part of finding out what you need, there is a consultation that needs to take place, and you have to pay for that. Okay, so let me be clear on that. For the IV infusions, the consultation for the IV infusions will be free. But if you're interested in the investigative portion, along with finding out the restorative IV, the consultation, you have to, there's a fee associated with that, because it's more in depth and it's more in detail versus just getting a consultation for what IV you think you should have. Okay. Hey, Pastor Marvin, thank you for joining on. Hey, Virginia Coleman, thank you for joining on. Please like, invite, and share as you come on. Hey, Mona Ali. Hey, Doris. Hey, who is that? That's Sinitra. Hi, how are you? Cassandra. Hello, everyone. Thank you, everyone, for coming on. Hey, Phyllis. Phyllis, hopefully you heard what I said in regards to the consultation. Phyllis is the person that you probably will talk to along with Tanisa when you call the office. So Phyllis, if they're calling for the IV infusion and they want to know what IV infusion may work best for them, the consultation will be free. But if they want the investigative portion for the restorative, which is the restorative IV, and they want the investigation with the testing, they have to pay for the consultation. For the designer side, which I say you just want an infusion, and you're like, I just want, let's just use this, say this for instance, you feeling tired and run down, and I want something to pick me up. So we'll just tell you out of the 22 infusion combinations that we have, which might work best for you, okay? Or if you're someone that's saying, I'm tired of this sinus stuff that's going on, we'll tell you what combination of infusion that we would think that will work best for you. So that part, the consultation will be free. But if you're doing the restorative IV portion, where you want the testing to investigate why you're feeling tired, then the consultation, you have to pay for the consultation. There should be a consultation involved with me or one of our providers, trained providers, that will be able to help you decide which one you want to do. So what I'm going to do tonight is We're going to talk about the IV micronutrient infusion. I call them micronutrient, which is nothing but the Myers cocktail. We're going to post that on there. You can have that within less than 30 minutes. It's not a huge bag, but it's a combination of vitamins that you can get within less than 30 minutes. Okay, and that's $125. Okay, and the other one that we're going to do is what we call IV pain relief infusion. And the reason why that one is near and dear to my heart, because you've heard me talk about the opioid epidemic. You heard me talk about the healing clinic that we have that helps people manage the pain that they may be having. And we also have a narcotic withdrawal combination for people that are we're weaning off narcotics. So for those of you that are under the sound of my voice, I do have some of my patients do listen to Medical Monday, and they are doing their investigative restorative, and we are actually all at the same time weaning them off of their opiates. This infusion, we highly recommend that you do this along with the weaning process. So we're doing this and we're doing it big. Okay, so and then I just want to give God the glory and a shout out. Thank you, Holy Spirit, and thank you, Jesus, because I not only the restorative and the testing tell us what we need to do. I even ask God, what is it a person needs, especially if it's an acute situation or urgent situation. Where people may need things, because I've had situations where I have to help people at the worship center or whatever the case may be, and I'm like, Lord, what is it that they need? And they say, and I hear the Holy Spirit say, give them this, and then when I go give it to them, I say, well, when was your last dose of? It just happened this past Sabbath. I like the Holy Spirit was like, give this person vitamin B12 because this person was having a panic attack, and so I was like, okay, I'm giving them vitamin B12. So when I gave them the vitamin B12, I was like, when was your last dose of vitamin B12? They're like, well, I don't remember. So if you're someone under the sound of my voice in an acute situation and they might be having a panic attack, you got to remember something. And you providers, we're going to teach this in a class. So I'm going to give you a taste of what you're going to learn during the class, is that a person that have an anxiety or a panic attack, there's certain stress hormones that are being elevated. And so one that are being released, neurotransmitters as well. Once they get to a certain level, there are enzymes that are released that connect with vitamin B12 to break down those stress hormones so a person can calm down. If there is no vitamin B12, that enzyme cannot effectively do what it needs to do to break down the stress hormone. So those stress hormones are like ding, and so that's when a person gets a panic attack. They feel like the room is closing in, their chest is squeezing, they can't breathe. They feel what they call that a sense of impending doom. And so vitamin B12 plays a very key role in that. So if you're a vegan under the sound of my voice, that's why it's very, very important that your vitamin B12, that you use that. I'm not saying that you will have a panic attack. I mean, there's a whole lot of other things that go along with that. But vitamin B12 is very, very important in keeping your neurotransmitters regulated, breaking down the along with the intrinsic factor in your tummy to break down food. It plays a role in so many things. So that is what some of the things that you're going to be learning in class with me. And they don't teach this in medical school. I've been through medical school and I didn't learn that in medical school. What I'm telling you is what I have learned through my coursework of treating patients and going to different places to learn and get my certification. I'm going through the last part of getting my anti-aging certification this May. I'm so excited about that. I will be going to Florida to get that done. So once I get back, I will have my credentials and certification in anti-aging. So, and it all goes in conjunction with my teaching with this course that will be coming up in June. So you will be getting your course subject and matter from a board certified anti-aging specialist. So I'm so excited about that. So I'm going to post the link on if you're interested in getting your micronutrient infusion. I'm going to be posting Both of the links. Come on, come on, come on. Both for the links in the comments section. It says copy. I'm gonna copy that. Go to Facebook. Da, 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 da. So if that's something that you're interested in doing, just click on the link, and you can pay for it right then and there. I gotta send it. And that will be part of what we call the designer side, because the designer side is we're not really doing the investigative work. I would like for you to try it. Yes, it goes right into the vein, and it takes less than 30 minutes for us to infuse you versus the big IV bag. Now, again, if you want to do, if you're saying, Dr. Grace, I have this issue going on, what do you recommend? Again, without the investigative portion, I can talk with you and tell you what infusion that we can have available for you, and that, well, this is what I recommend that you do. So there is different ways on how we do our infusions, but I'm excited to say, when I sat there and counted them all, I was really amazed. I knew we had some, but I didn't know we had that many. Like, again, like Phyllis was there looking. When I was like, Phyllis, I was just counting. I was like, we have over 20 something combinations of infusions that we can give people. And then I was like, and that's not including the customized, because the customized, you're an individual, so your combination may not be the same for someone else. Okay, and along with those infusions, we have, like I said, we have the anti-inflammatory that we can put in that infusion as an additive to combat inflammation, which is very, very important, because inflammation is the baseline for all disease. And we have for what we call our healing clinic, people that have joint pain, people that have muscle spasms. If you're someone under the sound of my voice that is having muscle spasms, or another way of calling it Charlie horses, or your muscles are cramping up or whatever, we have natural supplements that is not part of the, well, in the infusion combination, but we can add it to, but it's also infused to that, to help with that. And especially when we do our healing clinic, people get immediate relief. Yes. And what I also want to provide as part of the course subject, but it'll be an additional fee to that, if you're someone under the sound of my voice who's interested in learning how to do joint injections. Because we actually, instead of injecting steroids, which can be quite damaging to joints and to ligaments and to tendons, we can do joint injections with the natural supplements that we have that are made with 12 plants. And I will say this, especially with patients that are in severe and a lot of pain, we do add some lidocaine to that so they can get immediate instant relief. Right as soon as I put it in there, and they're like, oh my God, I can get up out of the chair. They're walking around. I'm like, okay, you are numb right now, so don't overdo it. So I can teach you guys how to do that as well. So that will be an additional cost if you are interested in learning how to do the joint injections along with your infusions. So and again, part of the coursework will also I think I went over everything. So, but if you're someone under the sound of my voice, I've had people to walk up to me at the worship center at Great Faith and say, Dr. Grace, do you do infusions? And I'm like, yeah, I've been doing them for years now. And they were like, I want one. So I'm excited to be able to share that with those under the sound of my voice, in the practice, outside of the practice. I do have some nurses and some nurse practitioners that are doing the same. That I trust, that I know that are integral and they do good work. But I want to talk to them before I give them a plug, because I really need to find out how everything is set up and how they do everything. I need to go and see myself. So I don't want to give them a shout out and I'm not saying anything. I have to go and see for myself. Just like the things that I share with you guys, I go experiencing it myself. So those of you under the sound of my voice, you know who you are. So I want to come out and check out your spot. I want to come out and indulge in what you have to provide. I mean, because teamwork makes the dream work, and girl power, okay? We have to support and celebrate one another. So if I am not able to accommodate you, if I'm booked and can't get you in and you want something right away, I want to be able to refer you to these providers. But again, I have to have a conversation with them. So I'm excited about them, for them, and about what we're about to do as well. So I appreciate you guys tuning in. Is there any questions? We're at it's 8:51. So is there any questions? Hey, Gwendolyn. Hey, Kimmy. How are you? You said, how much is the consultation? Oh, it all depends on what are you coming for the initial consultation. It all depends on how. Let's say, for instance, there's two type of consultations. One is the initial consultation. I've never seen you before in our practice. There's an initial consultation, right? But if you're someone that I see or treat medically already, and you're ready to do the alternative procedure, then there's a different price. So the initial consultation is $350, but you get a discount on your infusion, okay? Because you're paying that initial consultation. Now, the initial consultation is just not me talking to you, okay? I actually get a complete history from you. I actually do a physical exam on you. So you're actually getting a full workup from head to toe, okay? And so your history is very, very important. So we talk about your family history. We talk about what your allergies are. We talk about your surgeries and all that other kind of stuff. So I really spend a lot of time with you, and I actually lay hands on you, okay? And as a doctor, I actually do an examination, and I actually, if I feel led, I will pray, and if I get a word from the Lord, I will prophesy, and sometimes if I get a word of knowledge, I will say something, because most oftentimes when people come to see the doctor and they're dealing with something that has been chronic, there is a spiritual component to that. And so I thank God for the leading of the Holy Spirit that will reveal those things to me, because God reveals to heal. So, hey Doris, what is you? Let me see what did you say? Is that a question? I'm trying to see if there's any questions. Oh, thank you. Hi, Divine Favor. Thank you for joining on. Please like, invite, and share. We're going to miss you talking to you. Oh, that's so sweet. You guys are having private conversations on there. Is there anyone on here that has any questions about anything that I've said thus far? It is 8:53, and believe it or not, you get what you pay for. I know that's an old adage and an old saying. And so I know, like, people like to shop around and they like to get the best price. I understand that and I get that. But I have almost, I want to say, again, I have over 10 years of experience in the alternative versus the infusion world out there, okay? So you get what you pay for. And I'm not trying to say anything about anybody else. I'm not trying to throw off on anyone, but you get what you pay for. And I have to say this in regards to not only myself, but my team. I have a phenomenal team. My team is great. I mean, they go beyond the call of duty. They're good at getting back with you and any questions that you may have. They're willing to answer any questions or whatever the case may be. Our communication skills are impeccable. We have of course, with text messaging and stuff like that. We also have a texting system which is HIPAA compliant. If we need to communicate with you, we can do that as well as too. So I really am pleased to say that we have been providing this service for years now. So it's not new for us. But again, it's trending now. You see it everywhere. I mean, you almost see it everywhere. And you see places popping up and things of that nature. So, and there are some good pop-ups out there, because I know some of these people and I know what type of work that they do. I know what type of business people they are and what services that they provide. But again, I need to have a conversation and I need to go and see it for myself before I recommend anyone or whatever the case may be. Hey, Virginia, thank you for joining on. Please like, invite, and share. Is there anyone that have any questions? I'm scrolling down to see. Hey, Belinda. I see something about CBD oil. Hold on, let me see. CBD oils, are they good to use? Yes, they are good to use. CBD oils are good to use, especially for pain management, or whatever the case may be. They're not infusible, but they are can be good. I prefer that than medical marijuana because, especially if they have if you're dealing with THC, THC has no medicinal purpose, which means it doesn't have any health purpose. It just gives a euphoric state of being and causes a side effect of increasing appetite. Now, that can be beneficial for someone who has problem with eating issues, someone that is dealing with a terminal illness, and we want to get them to eat. Okay, I can see that. But there is also some other natural things that are out there that can stimulate appetite. So CBD oil minus the THC, yes, it can be used under the tongue. It can be used topically, and you can use it in a capsule form and all of that. Yes, so yes, it can be good because it is natural. But again, you have to know the dosaging and know what's best for the individual. All doses are not created equal, and all doses are not used for the same purpose. Okay, so if you are going to use CBD oil or get CBD oil from someone, you need to make sure that the person that you're getting from is educated in regards to its use and what is best for you as an individual, not what's best or what you read out there on the internet. What is best for you as an individual. And again, at Bethesda Holistic Center, we do health mapping, which is individualized, tailor-made health mapping for you. So hopefully that I answer your question. Is there anyone else? What are our best treatments for fibromyalgia? We have a vitamin infusion that is for fibromyalgia. We have a vitamin infusion that can be in combination for fibromyalgia. So we need to find out what are you deficient in, what is causing your fibromyalgia. Fibromyalgia has what we call a neurotransmitter component, which means nerve endings are firing and firing all the time and inconsistently. So something is missing to cause that continuous firing of those nerve endings. So you need to have you need to have a testing done, neurotransmitter testing done that we provided with us to find out what's going on. And once we find out what they are, then we supplement, be it orally or by infusion. So we actually have what we call a fibromyalgia infusion that can be used for fibromyalgia. Okay, I do believe that whatever your deficiency is for your fibromyalgia is not going to be the same for somebody else who has a diagnosis of fibromyalgia. It is different. So it is very important that you do the investigative portion, get a consultation, and we supplement you based upon your deficiencies or borderline deficiencies, and especially in regards to your neurotransmitters to get those regulated so we can get your body in a state where it can auto correct itself. So hopefully that answered your question about fibromyalgia. And if you're a provider who is interested in infusions and because you're going to have people that are going to come to you with these diagnoses. And so our course will help you with the investigative portion, and will give you a library of infusions and combinations of those infusions, along with where to get them from and all that. We're not just going to have you out there just trying to figure it out after you finish the course. And so we want you to be educated when you do these type of infusions. So I posted the links in the comment sections. So hopefully you guys will give us a call at 248-356. What is it? 248-356-1111 is the office number. So you can give us a call, and our website address is www.bw-center.com. That's our website. So go check us out on that. So is there medical Monday? Oh, any questions about anything? Those two questions were very, very good. Thank you for tuning in. It is now 9 o'clock. Wow, that time went by really, really fast. Hopefully, I answered all your questions. Let me scroll down just a little bit. Treatment for fibromyalgia. Is there a cure for fibromyalgia? Um, you have to be careful with using words like that and dealing in the natural homeopathic world. We cannot say that we cure, prevent, or treat any type of disease. So I cannot medical legally say that. But what I can say is that based upon who you are and what you're dealing with, your body can be put in a position to autocorrect itself. So if that means that you don't experience fibromyalgia again after it autocorrects itself, then the answer is yes. But I cannot say say that. I do believe there's a cure for everything. Do they want a cure for everything and for business purpose and money purposes? No, they don't want a cure for everything. So I've taught on this before, even with cancer. Our economy would not be able to sustain a cure for cancer. Let me say that again. Our economy, and I'm going to leave on this note, even though we're talking about IV infusions, our economy would not be able to sustain a cure for cancer. And people are like, well, Dr. Grace, why are you saying that? But you have to look at the big picture. First of all, there is millions and millions of dollars that is given to research. So if there's a cure for cancer, all those researchers and researchers' jobs are gone. Poof, right? That's just research. If there's a cure for cancer, all those doctors who did their training as oncologists, they don't have a job anymore. Poof, they don't have a job anymore. All the nurses that work with the doctors, they won't have jobs. Gone. Poof. All the medical assistants and other assistants that work in the office with the oncologists, they're out of work. Poof, right? All the manufacturers who make the chemo, the factories will close down. All those factory workers and people who own the factories and all of that, all those people, all those jobs are gone. Poof. Okay, there's a cure for cancer. Also, the people, the pharmaceutical reps who sell the chemo, their jobs are gone. Okay, all the people who administer the chemo, their jobs are gone. No more cancer centers. They're all gone. Poof, right? So you guys see where I'm going with this. So, and I know this is horrible, but they don't want a cure for cancer. They don't want a cure for a lot of things because the American economy would not be able to withstand it. Globally, the economy would not be able to withstand it because everything that I said is multiplied by countries. So I'm just going to leave you with that thought. Again, I'm Dr. Grace Patterson, Managing Owner of Bethesda Holistic Center and Everything New Alternative Medicine. Where I'll be completing my board certification in anti-aging real soon this year. So, and I place links if you're interested in, if you're a provider under the sound of my voice who wants to enroll in our class, our courses that are coming up, and learning how to properly do IV infusions and to learn about the 20 plus combinations of infusions that you can provide for your patients and in your practice or whatever the case may be. How to correctly combine supplements to help the body to combat disease states. Like I said, we have over 25 combinations, and that's not including how to do the custom IV infusions based upon the investigative work that you would do for your patients, and we will show you and teach you how to do that. How to give IV supplements under 30 minutes. We will show you how to do that. How to do health mapping. And if you are a patient, you should want a health map. and medications and supplements, when to give and when not to give, and how can they work synergistically together. So if you're under the sound of my voice as a patient or provider, you should call us, because we have the experience and we have what would they call the medical evidence to prove that what we do helps and it works. So, and we will also teach you how to do natural pain management as well. That's part of it as well. You will get a whole wealth of information. I see you down at hospice. Oh yeah, I forgot to mention that all the people for hospice, they'll be out of work. So you're right, Miss Divine Favor. I forgot that part of it. I got an important phone call. I'm going to be listening. Oh, okay. Thank you for joining in. You got it. You understand. Oh, thank you guys. Thank you. I appreciate you guys for tuning in. I'm Dr. Grace Patterson, manager and owner of Bethesda Holistic Center. Thank you. Tune in next week. We're going to be talking about hair restoration. Okay, I've talked about that before. We're going to be talking about it again. We even have a hair restoration infusion. Okay, so that's one of the 25 that's in our catalog. But we're going to be talking about platelet replacement therapy for edges and for male pattern baldness. We're going to be talking about that and how to address hair restoration from the inside out. So please, and tune in next week to Medical Monday. If you know any cosmetologists, please tell them to tune in next week, because we're going to try to partner with them, because they most oftentimes see these women and men, barbers too, because you see Meredith's stuff on Facebook now. Men are getting weaves and getting wigs and all that other kind of stuff. So platelet replacement therapy does work if you stick with it, and and it works from the inside out. So I in conjunction with investigative stuff, so we can also help people restore a healthy head of hair. So thank you so much for tuning in, and I will see you guys next week for hair restoration, how to get those edges back. Thank you so much for tuning in. Grace and peace. God bless. Bye for now.